Thank you for submitting your manuscript to Regional Anesthesia and Pain Medicine. To facilitate readability, comprehension, and editorial efficiency, we have standardized our approach to data presentation. Tables and figures should accentuate and efficiently summarize the findings of the study. They should contain enough information to be impactful without reading the manuscript. When creating tables, please use word processing software. Each measurement and its corresponding measure of spread must be in its own cell. Tables should always have at least 2 columns. For categorical data, include frequencies along with relative percent. The denominator information should be available in the columns. Indent row labels to illustrate subcategories. Include p-values in a separate column with a footnote indicating which statistical tests were used. Results should be either less than 0.001, less than 0.01, or a precise number with 2-digit rounding. Superscripts and footnotes should be labeled as A, B, C, D. Do not use special symbols. Add a footnote if the column data does not add up to 100%. Please use either 10 or 12-point font for tables. Each table and figure should be referenced in the text and included at the end of the manuscript. When creating figures, each must contain a title that fully describes what is shown in the figure. Groups should be labeled on the lines or with a legend. Do not include animations. Do not include pie charts. The y-axis should not contain vertical text. Footnote superscripts should be indicated by A, B, C, D. Distributions of continuous, normally distributed data should be summarized using the arithmetic mean and standard deviation. Continuous data that are skewed, i.e. not normally distributed, should be summarized using the median and interquartile range. RAPM strongly encourages visual display of complex data. One of our favorite approaches is to create a forest plot to display odds ratios, relative risks, or means. Such a figure is immensely helpful when trying to display measures of association. When possible, and where appropriate, try to include both crude or unadjusted and adjusted data. For all randomized trials, a sample size calculation is required. Sample size calculations should include the chosen power of the study to detect a difference, traditionally set at 0.8, the chosen critical alpha level, traditionally set at 0.05, anticipated effect size of the intervention, and the measures of central tendency and dispersion in the 2 groups. Then, finally, in the text of the results section, avoid restating all the findings. Instead, focus on the primary findings of interest. The presentation of results should answer the research question or hypothesis. In general, results should first be reported unadjusted with appropriate estimates of uncertainty. Present absolute rates and proportions prior to presenting comparative measures of association, such as relative risk and odds ratios. Do not use subjective qualifying terms for non-significant results, such as trend toward. For all observational study designs, i.e. non-randomized studies, avoid using language that suggests causality. For instance, avoid describing results in the context of terms such as effect or efficacy. Instead, discuss relationships as associations. For all study designs, clearly state the primary and secondary outcomes. Manuscripts should follow data reporting guidelines as outlined in the Equator Network Consort Guidelines. For more information, check out the following resources online.